We've got three fantastic speakers to start with, and then we'll have a panel discussion following that. And if you have any questions as we go through, there's a Q&A open, and please do feel free to pop questions you might have for the panel in the Q&A as we go along, and then we can feed those into the discussion. So we'll get started. Our first presenter is Professor Deborah Roberts, who we're really delighted could join us. So Deborah is a scientist who spent 4 decades working at the interface of science and policy and practice in biodiversity planning and management, in climate change adaptation and mitigation and sustainable development, and focusing on resilience at local and international levels. And her pioneering work in this field has helped to reduce vulnerability in human and natural communities. It's enhanced local level sustainability and resilience, created socioeconomic development opportunities, and driven huge institutional change. Professor Roberts was the lead author for the Urban Areas chapter of the 5th assessment report of the IPCC in 2015, and then was elected co-chair of Working Group 2, which focuses on impacts, adaptation and vulnerability, for the 6th assessment, which ended just this year. So she's been very busy. She's an honorary professor at the University of KwaZulu-Natal and an advisor to the Global Commission on Adaptation, United Cities and Local Governments, and the United Nations Secretary General's 2019 Climate Summit. And in 2019 and 2022-23, she was included in the list of the world's 100 most influential people in climate policy. So we're really delighted to have her here this morning to give us an overview of the background to climate change and the work of the IPCC. So Deborah, I'll hand over to you, and thank you for talking to us.
Thanks so much, Sarah. Let me get my slides up. And welcome to everyone who's joining this particular session. Let's see. All right. Hopefully everyone can see that.
Yeah, all good.
Wonderful. So good morning, everyone, and thanks for joining us. It's the first time I've engaged with the medical community focusing in on cancer. So good to meet you, and looking forward to the conversations that flow. What I'm hoping to do is really give you a sense of some of the key findings that have emerged from the latest assessment reports of the IPCC, or the Intergovernmental Panel on Climate Change. The IPCC works in assessment cycles. They're generally 5 to 7 years long. And during the course of assessment cycles, what we do at the end of each cycle is produce a synthesis report. And what I'm hoping to do is to dive into that synthesis report, pull out some key messages for you, and hopefully that will spur the conversations in the community. The synthesis report is really important because it allows us to draw together the key findings of any particular assessment cycle. And this has been the longest and busiest of the IPCC's assessment cycle. We've produced 3 special reports. And I'm sure some of you may know about our special report on 1.5 degrees of global warming. It certainly has spurred a whole level of new debate in terms of global climate change negotiations, but also at local level in terms of local responses. We've also produced a special report on land and one on oceans and cryosphere, so the frozen parts of the world and the oceans, and 3 big global assessments. And these are produced by the 3 working groups. Working Group 1 looks at the physical science behind climate change. And Working Group 2 and 3 look at the so what aspects. So what do these changes mean for us? Working Group 2, which is where I was a co-chair, looks at impacts, adaptation, and vulnerability. And Working Group 3 looks at our opportunities to mitigate climate change. So if we look at that synthesis report and really take a helicopter view of some of its key messages, you'll see that the science isn't pulling its punches anymore. We make it very, very clear that our current trends of emissions and our current development path are simply incompatible with an equitable and sustainable world. And perhaps not surprising, we've had over a century of fossil fuel use. We've had over a century of unsustainable land use, of unsustainable energy consumption. And what it's done, it's created a world where the 10% highest emitting households are responsible for about 40% of global greenhouse gas emissions, while the 50% of households with the lowest emissions are responsible for less than 15%. So you can immediately see in the cause of the problem, there's a distinct division in the world. And that's important because there's also division in the impacts, as I'll show you later. We're also living currently on a very rapidly changing planet. Our monitoring of the planetary system shows us that global surface temperature has changed faster since 1970 than in any other 50-year period in at least the last 2,000 years. And when we released our special report on global warming of 1.5 degrees Celsius in 2018, we told the world that up till that point, we had seen an increase in global average surface temperature relative to the pre-industrial period, and we use 1850 to 1900 as a proxy for that period, on the order of 1.1 degrees Celsius. By the time we released the synthesis report in March of this year, we had to update that figure to 1.15. And I know for those people who are not in climate change science, one could say, well, 0.05 of a degree, do we really need to worry about that? I'm hoping you'll see by the end of this particular presentation, that's a significant change and definitely something to worry about. And as a result of this human-induced climate change, what we have seen is a widespread range of dangerous changes in all aspects of the planetary system, the atmosphere, the ocean, the frozen parts of the world, the cryosphere, and the biosphere, the living parts of the world. What really interests me as someone who trained as a natural scientist is, well, how have we ended up in this predicament? Did we not have the knowledge? Did we not have the science to inform our decision-making? And the sad answer to that is simply no. We've known about greenhouse gases. We've known about the greenhouse effect since the 1800s. Just before the Second World War, the very famous Scottish chemist Guy Callendar showed that there had been an increase in the warming of the atmosphere over land on the order of 0.3 to 0.4 degrees Celsius. And even then, he attributed half of that change to the carbon dioxide that our activities were producing. After the Second World War, we continued to see climate change science advance. We saw the emergence of climate modeling, and ultimately the concern around human-induced or human-caused climate change continued to grow. And that led in 1988 to the establishment of the Intergovernmental Panel on Climate Change. And really the role of the IPCC is to provide policymakers with an objective source of scientific information about the causes, the impacts, and probably most importantly, the responses to climate change. The IPCC produced its first assessment report way back in 1990 and indicated that at that point we had already experienced about half a degree of global warming. And that was an incredibly influential report because what it did is it influenced the establishment of the United Nations Framework Convention on Climate Change, or UNFCCC. You can see we love acronyms in the climate world. And that convention is really important because it's the convention under which currently 198 governments come together at the end of every year to discuss climate change responses and international climate change policy. These meetings are referred to as the COPs, or the Conference of the Parties. Probably the most significant COP to date was the one in 2015 held in Paris, which resulted in the emergence of the Paris Agreement. And the Paris Agreement is really the umbrella under which all countries are currently operating. Sadly, the number of COPs continues to increase. And it sounds like Mxolisi and myself are busying ourselves to go to COP28 in Dubai. Sad to say, with a problem as serious as this, one would have imagined we could find a solution within 5 or 10 COPs, but no, we are staggering on to COP28. And at the same time as the number of COPs continue to increase, so the carbon dioxide levels in the atmosphere continue to increase. If we look at current levels, when I last checked the NOAA website, we are currently sitting at 419 parts per million carbon dioxide in the atmosphere. Now compare that to the fact that during the course of our entire civilization, the levels of carbon dioxide have been roughly 280 parts per million. So effectively our activities, the activities of the human race, have raised the atmosphere's carbon dioxide content by 50% in less than 200 years. Not surprising, given the level of the impact we're having on the planet. Our assessment shows us that we're experiencing dangerous impacts both on natural systems and people, literally around the world. There's no region that's immune. We're seeing an increase in the intensity and frequency of heat waves, both on land and in the ocean. And you would have seen a lot of media coverage about the extent to which our oceans are heating, driving heat-related mortality on both land and in the ocean. An increase in heavy rainfall events. My own city, Durban, experienced a massive rainfall event in April 2022, which has devastated our water and wastewater infrastructure. We're still battling to recover. A similar increase in agricultural droughts. The proportion of tropical cyclones has increased. We're seeing reduced water security. About half of the people in the world experience water scarcity at least once during the course of every year. Millions of people are being exposed to acute food insecurity, largely in Africa, Asia, the least developed countries, South and Central America, the small islands, and the polar regions. We're also seeing a slowing in the growth of agricultural productivity. So on a continent such as Africa, which faces food insecurity issues on an ongoing basis, our agricultural productivity has decreased by 34% since 1961. Because our oceans continue to heat, they're becoming more acidified. We're seeing a reduction in the yield of fisheries and shellfish yields. We're seeing intensified impacts in the world's cities, not only because of heat waves, but also because of flooding, leading to a loss of infrastructure, livelihoods, and lives. And we're seeing economic impacts in the climate-exposed sectors of our economy, so things like agriculture, forestries, fisheries, energy, and infrastructure. So we know that we're the cause of the problem. We know that there are changes. We have begun responding. And what our assessment showed us, though, is that although the pace and scale has picked up, it's still inadequate given the current challenges we face. So our current plans are simply insufficient to tackle the climate change challenge. Now, there are two main areas where we have an ability to respond to the climate change challenge. One of these is adaptation. So adaptation is adjusting to the changes that we've already experienced and that we project will occur, both to minimize the harm, but to maximize the opportunities. What our assessment shows us is that adaptation work has progressed across all sectors and regions, but it remains fragmented, incremental, and sector-specific. So we've got this very large adaptation gap between what we should be doing to adapt to climate change and what we are doing. And that gap is going to continue to grow if we stick to business as usual. Where we have seen effective adaptation emerging largely in the agricultural sector, so things like on-farm water management and improvements in soil moisture conservation. We're also seeing an increasing uptake of ecosystem-based adaptation in places like cities, where they are, for example, focusing on preserving wetlands to reduce flood risk. But the really important message is we can no longer adapt our way out of the climate change problem because there are real limits to adaptation. And these can be hard limits. So, for example, physiological limits. Livestock no longer can exist outside because it's simply too warm, and there can be soft limits. So there are options to reduce intolerable risk, but we can't use them. So we're already seeing some of these limits emerge. There are already several ecosystems that are at risk from climate change, so those hard limits. These are the warm water corals, the coastal wetlands, the rainforest, the polar and mountain ecosystems. We're seeing soft limits, for example, with small-scale farmers and households in coastal regions who could adapt further, but there's not adequate policy in place or financing to enable that. Financing, big challenge from an adaptation point of view. Only a very small portion of the money that goes to the climate change response globally is going to adaptation, which is obviously a big problem for continents like Africa. And we're beginning to see maladaptation emerge. So unintended consequences coming from our adaptation action. So as the world warms, we put more air conditioners into our homes, into our workplaces, for example, and depending on how they're powered, those could lead to an increase in greenhouse gas emissions and continue to drive the problem. And unfortunately, as always, it's the marginalized and most vulnerable who are affected. Also important to realize that even if by some miracle, all the money was available that we needed for adaptation, we put in place our most effective adaptation beginning today, we can no longer avoid the adverse impacts of climate change. Our future does hold losses and damages from climate change. It's now unavoidable. The second major front on which we can tackle the climate change challenge is mitigation. And this is about reducing those greenhouse gases going into the atmosphere or increasing the sinks that absorb them. And what our assessment shows us is that we've put in place more policies and laws, But unfortunately, the pledges that we've made are not really adequate to meet the Paris goals of keeping temperature below 2 degrees Celsius. And there's a big gap between the pledges and what is actually being implemented. On this slide, you'll see I make reference to 2020 and 2021 because that's the work of the IPCC is very strongly grounded in hard cutoff dates for literature. But if we look at some of the more recent literature that's emerged after our assessment, and this is from a paper looking at emission ranges linked to current policies and current pledges with net zero, if we look at only implementing domestic policies in countries, so not talking about their commitments under the Paris Agreement, that would take us to a median temperature increase of about 2.6 degrees Celsius. If we added to that the high confidence net zero targets, that would drop to about 2.4 degrees Celsius. It's only when we think about a totally unrealistic package of implementation, which is current national policies together with all of the nationally determined contributions. So the NDCs, more acronyms, are the climate plans that the governments provide to the United Nations Framework Convention on Climate Change to show the extent to which they're acting to help realize the goals of the Paris Agreement. There are two forms of NDCs. One is unconditional, so the country can implement regardless, but a large number of them are conditional, generally from the Global South, because we require technical support, require financing. And this package would also require all of the net zero targets to be implemented, both high credibility and low credibility. And the bulk of current net zero targets are all lower credibility. They're not locked into law, financing is not clear. So only with that very unrealistic package of implementation do we get to 1.7 degrees Celsius. And if we remind ourselves about what we negotiated in Paris, and I was a climate change negotiator for South Africa at that point, we negotiated to achieve well below 2 degrees Celsius above pre-industrial levels and to pursue efforts to limit the temperature to 1.5 above pre-industrial levels. And you can see within this range, we don't get anywhere near either one of those. And so not surprising that the technical dialogue of the first global stocktake, and the global stocktake is the mechanism in the Paris Agreement where we come together as a global society every 5 years to look at the extent to which we're being successful in fulfilling the goals of the Paris Agreement. The finding of the technical dialogue of the first global stocktake indicates that we're simply not on track to achieve the goals or the long-term goals of the Paris Agreement. If we look at mitigation to date, where we have been successful, we've seen expanding policies to reduce greenhouse gas emissions at all levels of government, from national down to local. There are an increasing number of technically viable and cost-effective options around, so a big increase in solar and wind energy. And in fact, just this year, the International Energy Agency in their most recent report indicated there had been an unstoppable shift to renewable energy, but they qualified that we're still not phasing out fossil fuels fast enough to be able to meet the goals of the Paris Agreement. We're seeing an uptake in energy efficiency, demand-side management, better electrification of urban systems, more green infrastructure in our cities. We're managing our crops and grasslands better, and we're reducing food waste. Unfortunately, the devil's in the detail. We're also seeing lags in adoption of these low-emission technologies in the developing countries because of the usual problems, lack of finance, challenges with technology development and transfer. And even with mitigation, where the bulk of our money is going at the global level, financial flows still fall far short of what we need. We need about 3 to 6 times more money than is currently being invested in the climate change challenge. So basically, our assessment points to the fact that as a society, we're simply ill-prepared for the hazards and extraordinary threats we face today and well into the future. What of that future? Usefully, there have been a number of scientific advances which allow us to have a better handle on what the future will look like, depending on the choices that all of us make today. Because we haven't been adequately ambitious in mitigating the production of greenhouse gases, we're more likely than not to reach the level of 1.5 degrees Celsius in the first half of the 2030s. In fact, just last week, I saw a paper which says no. In fact, we are likely to reach 1.5 in about 2029. The problem is, I think when climate scientists talk to policymakers and decision makers, this 1.5 degrees of global warming has got locked into people's head as a safe limit. People seem to think that this is a safe world that we'll be creating if we're capable of limiting global warming to 1.5. It's simply not. At 1.15, we live in a disastrously dangerous world, even now. Think about the wildfires at continental level in Australia, in Canada, the heat domes we've seen in the northwest of the Americas, the drought we've just had in the Horn of Africa, the floods in Libya, the heat waves in Europe and in China. We already at 1.15 live in an extremely dangerous world. If we get off the carbon superhighway at 1.5, we are going into an even more dangerous world. And I think that's an important thing to realize, is 1.5 isn't safe, but it's certainly better than higher temperatures. Why is it better than higher temperatures? Because our risks, our impacts, and those losses and damages increase with every increment of warming. So every fraction of a degree counts. That 0.05 really does count. It makes a big difference. We've also shown in our most recent assessment that the high risks now occur at low global warming levels than we previously thought. So things like threats to unique and threatened ecosystems, extreme weather events, large-scale singular events, all occur at lower temperatures than we previously thought. So if we look at a future with future emissions increasing, that means further warming, which means every aspect of the planetary system will continue to change. Every region will continue to experience an increase in climate hazards and be impacted in different ways. Tropical cyclones will increase in intensity. We'll see more melting of ice and snow, and that's been in the media a lot. That will drive sea level rise, which in turn will drive coastal flooding. We'll see biodiversity loss, a reduction in food production, and significant health impacts. So an increase in heat-related deaths, spread of diseases like malaria in Africa, impacts on our mental health, and obviously impacts on malnutrition. We also see changes in extremes. They'll become more noticeable, and I think we've all seen that over the last 2 to 3 years. And we'll have to manage compound and cascading risks. This is where risks begin to occur together. So a good example would be the Horn of Africa, where we've seen extreme heat and drought occur together. That means reduced soil moisture, that impacts on food yield, but also reduces the ability of people to work outdoors. So you can't work, the food supply is reduced, that reduces household income, it increases food prices locally, sometimes globally, that drives an increase in food insecurity, increases malnutrition, and all of this decreases quality of life. So we can see how complex these challenges are to manage. So what we indicate in the synthesis report is, taking all of this knowledge, if the world continues to warm, what we will see are further increases in climate hazards in every region in the near future, not in some distant future, but in the very near future. And these adverse impacts will escalate with higher temperatures. So if we think about the hottest average day that we might experience, we'll see that increase in temperature as the world warms, particularly in the mid-latitudes and the semi-arid regions. Soil moisture will decrease as the world continues to warm, impacting on our ability to produce food. A big impact on species and species losses. If we think about a world warmed at 3 degrees, the risk of extinction in the world's biodiversity hotspots is 10 times higher than it would be at a world warmed at 1.5 degrees. We'll certainly see increased risk to human health from heat and humidity as the world continues to warm. And if you look at these maps, you can certainly see that above 2, one really has to begin questioning the habitability of the tropics. And we know in the tropics, we've got many vulnerable human populations, many vulnerable ecosystems. Obviously, a big impact on food production as the world warms, impacts on staple crops like maize, decreasing yield, negative impacts on fisheries yields as well. And so, as I said before, we're now looking at a future where losses and damages, these adverse impacts of climate change, can't be avoided. They are simply a part of our future. And unfortunately, they're going to disproportionately affect the most vulnerable people and ecosystems. So that 50% of households responsible for less than 15% of emissions, they are the people who are going to be most negatively impacted. But it is important to realize the actions we take now can help reduce the losses and damages. Why are we hitting these limits? Well, obviously, adaptation options become more constrained the hotter the world gets. If you think about ecosystem-based adaptation, you can't utilize it if the ecosystems can't survive because the world has got too hot. There are certainly negative impacts on important sectors like water management. So above 1.5 degrees Celsius, there'll be insufficient fresh water available to certain island living or mountain living communities to survive. We'll see irreversible changes, species losses, loss of biodiversity, particularly in those high-risk ecosystems that I spoke about. They're already on the edge, the warm water corals, the coastal wetlands, rainforest, polar and mountain ecosystems. We'll see dangerous feedbacks in the climate system. So, for example, the thawing of the permafrost will release carbon into the atmosphere, which will make it much more difficult for us to pull the Earth's temperature back to 1.5. We already know that we're committed to unavoidable sea level rise over centuries and millennia, but we can limit further acceleration. There's also the danger above 1.5 of severe infrastructure damage, particularly in low-lying coastal settlements. We know by 2050, about 1 billion people around the world will be experiencing the negative impacts of sea level rise in low-lying coastal cities and small island states. And so we can see from the work of the IPCC, there's absolutely no doubt that climate change is an existential threat to our well-being. It's a threat to our livelihoods, the global economy, and the natural systems that are really critical to our survival. And importantly, behind that is this issue of equity and justice, because it's the vulnerable people who've contributed the least who are going to suffer the most, and they're going to suffer disproportionately from the impacts of climate change. Currently, we've got almost half of the world's population living in regions that are highly vulnerable to climate change, so somewhere between 3.3 and 3.6 billion people. Between 2010 and 2020, we saw deaths from floods, droughts, and storms, the current big impacts from climate change, being 15 times higher in the vulnerable regions of the world, so largely the global south or the developing countries, compared to the more resilient regions, so largely the global north. And exposure to climate hazards continues to increase with growing inequality. This is a very unequal world we still live in, growing urbanization. We're going through the most rapid period of urbanization in our species history, and other trends such as migration. Unfortunately, it's those people who rely directly on the land and the sea to make a living, so smallholder farmers, small-scale fishers, who are most vulnerable. And really, without strong climate action, these losses and damages are going to continue to disproportionately affect people in Africa, Asia, the least developed countries, South and Central America, the small islands, and the Arctic. So in 2018, when we released the first report of the cycle, the Special Report 1.5, we warned society that an unprecedented challenge lay ahead if we were to keep global warming to 1.5 degrees Celsius. Unfortunately, 5 years on, all we can say is that challenge has become greater. So what do we need to do? Well, it's really important in this decade that we escalate our investment in adaptation to close the adaptation gap. It's really important, if we're serious about well below 2 or pursuing 1.5, that we see rapid and deep emission reductions. We should be seeing a drop in emissions before 2025. Currently, all we're seeing is an increase in emissions. We're currently investing $7 trillion every year in fossil fuel subsidies. So that's far greater than any investment we're currently making in renewable energy. And probably the most important number in the synthesis report is that by 2035, we've got to reduce global emissions by 60% relative to 2019 levels. Now, why is this significant? Well, 2035 marks the end date of the second round of those climate plans, the nationally determined contributions that governments provide to the United Nations Framework Convention on Climate Change. And those plans have to be prepared next year and submitted in 2025. So over the next 2 years, we have to find a way of emission reduction or putting in place plans that allow us to reduce emissions by 60%. Now, to show you what a tall order this is a figure from the technical dialogue of the first global stocktake. It looks at projected emissions related to the existing round of nationally determined contributions, and those projections are out to 2030. You can see those indicated in red. The blue and the turquoise line indicates the IPCC indicated level of emission reductions if we're serious about limiting temperature to below 2 or 1.5 without any degree of overshoot. And if you look at that 60% and the red, I begin to doubt what is possible in that regard. So it's very clear that the extent to which our generation, future generations are going to experience a hotter, a different, and certainly more dangerous world really depends on the choices we make in the near term. We produced this infographic. I think it's the most successful from the synthesis report, which indicates the generational impact given a range of emissions scenarios and related temperature change. So if you look at the baby boomers, so those of us who are the cause of the majority of the problems that we're facing, we're probably going to enter into a hot and uncomfortable retirement, but probably okay for us. Our children, our grandchildren are the people who are probably going to suffer the most, potentially under high emission scenarios, looking at a world warmed by 3, maybe even 4 degrees Celsius, which is a real existential threat. And this changes people's perspective of the future. And that really came home to me. I attended a Presidential Climate Change Commission meeting in South Africa earlier this year. And the Youth Commissioner was talking about conversations she was having with her peers. And they really just wanted a chance to die of old age. And for me, that's a profound recognition. I certainly didn't think about that at their age, that our youth really just wants, their aspiration is to die of old age. WWF took our infographic and showed it's not only generations, human generations that are impacted, it's also generations of species and ecosystems. And these are really vital in supporting our thriving society. Without them, the world becomes deeply unsustainable. And so it's very clear, every decision counts. We've got a very rapidly narrowing window of opportunity to enable climate resilient development. So ambitious adaptation together with ambitious mitigation, with a view to achieving sustainable development for all. So there's equity and justice in the way that we act. And what is very stark in the synthesis report is a recognition that the choices that you and I and everyone on this call make over the next couple of years during the course of this decade will have impacts both now, but for also generations to come, for thousands of years in the future. They will be reaping the outcomes of our decisions. The good news is there are multiple effective, feasible, low-cost options that are available to help us mitigate and to adapt to climate change. In the Working Group 2 and 3 report, we talk about the key system transitions that are necessary to effect the transformation that's required. Certainly a transition in the energy system, moving to electrification of all end users, using low carbon sources. In the industrial system, new processes, new fuels. Cities particularly offer us an enormous opportunity because we are urbanizing so rapidly. So the way we plan and manage and build our cities is critical. In terms of natural systems, our working group pointed to the need for effective and equitable conservation of 30 to 50% of the world's natural ecosystems, a huge task. In terms of the health and nutrition systems, underscore the importance of basic services like clean drinking water. And in terms of society, the need for social safety nets, because we are entering the world of win-lose outcomes, and we need to try and protect those who are going to lose. We do point to the fact that there are multiple opportunities to scale up our climate action, and that this work between adaptation and mitigation can be mutually reinforcing and can help us achieve the Sustainable Development Goals. So things like nature-based solutions allow us to increase adaptive capacity to mitigate, but also to achieve sustainable development. And that's really important because currently we're on track to only implement about 15% of the targets linked to the SDGs. But an important message, I often meet people who think there's some great technology that's going to come and save us. Simply, there are no silver bullets. We need a far-reaching transition across all sectors and all aspects of society. So literally a whole of society and a whole of economy approach. Again, there are tried and tested policy measures we can use to improve our mitigation and improve our resilience, but they need to be scaled up and applied widely. And these are things like targets to increase regulatory certainty. That's what the private sector is always calling for. Regulations to support the emission reductions required. Insurance to create social safety nets. Technical innovation and technology transfer to low emissions growth. And of course, international cooperation, which is critical for achieving ambitious action. Key to this, though, is show me the money. Finance is critical to enable action, but also to build trust. If we're serious about sustainable development, we need to scale up climate finance dramatically, particularly to developing countries, where the finance gap is the largest, but also where the opportunities for change are the greatest. And the good news is there is sufficient money around, but we've got to remove the barriers. What does that mean? Well, it basically means an overhaul of the global financial system. We've got to change the way the multilateral development banks work. We need to see more finance out of those global capital markets and more supporting public monies coming out of the developed economies. We need grant-based public financing for adaptation, absolutely vital. It needs to go to the most vulnerable regions, such as sub-Saharan Africa, and the most vulnerable communities, the informal settlements. Mitigation, different challenge here. Private sector is interested, but we need to leverage in those funds through public financing, which takes the risk off some of the mitigation in the newer sectors and in the developing regions of the world. But there is a huge gap. You know, a great fanfare was made in the media. We had the inaugural Africa Climate Summit in August of this year in Nairobi, and a lot of media attention to the fact that 23 billion was committed to action in Africa. But bear in mind, Africa by 2030 is going to need 140 to about 400 billion just for adaptation alone. So we can see how big the gap is. Over and above money, technology, we need to go back to that equity and justice piece. All of these actions need to be fair. They need to be inclusive. We need to be sharing our diverse knowledges, which is why it's great that the climate community and the health community are coming together today, because together we create more sustainable outcomes and a greater chance for transformative change. But that transformative change is going to take trust and working together, which is quite challenging if we think about the world that we live in. So those are the messages from the IPCC. The science is clear. We can act, but the window of opportunity is small, and we've got to act in an equitable way so that everyone can take advantage of the action. So I'm hoping this input will help spur debate in your community. And thanks very much for the opportunity to chat today.
Thank you so much for that, Deborah. Really fantastic overview of where we are at the moment. Very slightly depressing overview of where we are at the moment, but a real sort of spur to action, I think, going forward, and a lot for us to think about as a community about how we spur on with the urgency required that you were talking about. We'll move on now to our next presentation. So next we have Dr. Rizal de Guzman. Rizal works as a medical oncologist and is an associate professor at the Manila Central University FDT Medical Foundation Hospital in the Philippines. She's the immediate past chair of the Asia Pacific Regional Council of ASCO, the American Society for Clinical Oncology. Her clinical interests are in breast, head and neck, and thoracic cancers. She's written about issues in global oncology, including vulnerability of patients in Asia Pacific due to climate change and natural disasters, and has also worked on ASCO committees and working groups, including international affairs, the leadership development program, and working on resource stratified advisory groups. Rizal, thank you very much for joining us. And if you want to share your screen, I'll let you go ahead.
Thank you, Sarah, for the introduction. I just want to make sure if everybody is seeing my screen.
Yeah, we can see.
Thank you. So thank you for the invitation, and I will be sharing the impact of climate change on cancer care. While I am not formally trained in climate health, my perspective on the impact of climate change on cancer care stems from my practical experience as an oncologist, and my insights are informed by my lived experiences and observations witnessing the impact faced by patients and healthcare systems. So we know this is our alarming reality. We have witnessed extreme weather events from droughts in East Africa, Chile, the devastating floods in Libya, Brazil, all those floods, typhoons, and heavy storms sweeping across the different regions of the world, hurricanes in the United States, devastating hurricane in Mexico, and of course, the wildfires in Canada and Hawaii. And we know that it's the human activities that's driving global warming. And the way we live, the way we work, the way we use cars for our transportation, those activities are making our planet really warmer and warmer at each year. And we know that it is the accumulation of CO2 as well as other gases that's producing the greenhouse effect. The Earth's temperature has been rising, as what has been shared also by Professor Roberts, and the increase in the temperature will cause more catastrophic extreme weather events, as well as devastation, not only in the lives as well as in the uh, industry, agriculture, and food security. So the impacts of climate change on human health are various, from mental health impacts as well as um, pollutions causing exacerbations of asthma, allergies, as well as cardiovascular and respiratory diseases. Extreme health may impact other illnesses as well as cardiovascular failure. Droughts will have impacts on water supply, dust storms, and the environmental degradation will cause forced migration and insecurity in terms of job and income. And the wildfires and smoke will cause not only loss of homes, as well as cardiovascular and respiratory diseases, degraded living and social uh, impacts, food security, water quality, and all those uh, changes in the environment, such as rising sea levels and more extreme weather, are causing several disorders and strains on social relationships as well. Not too many oncologists are aware of the intersection of cancer and climate change. And what is more important is the carcinogen exposure that's happening with all these extreme weather events. Another important factor is the disrupted healthcare access that's being experienced by patients and healthcare professionals. And there are also the impact on the environmental footprint of cancer care. And of course, there are associations between the health co-benefits that go with our climate action. So in terms of carcinogen exposure, we are seeing those wildfires getting more extreme. And these are, in addition to that, the air pollution, these are exposing people to dangerous carcinogens, including PAH, particulate matter, specifically PM2.5. These are all implicated in the causation of lung cancer, as well as EGFR mutant lung cancer, specifically among non-smokers. Other carcinogens, including nitrogen oxide, benzene, and dioxin, are also very important and are implicated in other types of cancers, including breast cancer, which is the most common cancer among women. The loss or depletion of ozone layer and the exposure to ultraviolet radiation is increasing the incidence of skin cancers, as well as contamination with a mycotoxin called aflatoxin is causing an increasing incidence in liver cancer. Just recently, researchers from Australia did a work on identifying the specific potential cause of increasing incidence of liver cancer in Australia. And they concluded that the distribution of liver cancer in the country may be due to or may be linked with climate in Australia. And they found out that most of the incidents of liver cancer recently in the country were mostly situated in the equatorial regions. The thawing of permafrost, which is usually seen in Russia and Siberia, release massive amounts of uranium underground, and the product of uranium decay, which is radon, is known as a lung carcinogen, which is released during the thawing of permafrost. Also, permafrost is a natural reservoir of mercury, and when permafrost thaws, mercury may be in the waters and may reach the aquatic habitats, and that might reach humans when we consume fish and other aquatic resources. So the melting of Arctic ice, as well as ice melts, there are chemicals such as DDT, which are released into the environment, to the air, and that is a possible carcinogen as well. So the impact of climate change on cancer continuum may be evident not only in terms of treatment and carcinogenesis, but from prevention and screening, early detection, as well as in survivorship. And we have seen that during the COVID-19 pandemic, when there were extreme lockdowns and patients were not able to have their appointments due to cancellations and disruption of treatments and follow-ups. There were prevention and screening tests were delayed. And of course, the dietary factors will also have implication in terms of the environment and agriculture being affected. The diagnosis of early diagnosis of breast cancer, cervical cancer, colorectal, and maybe other cancers may be impacted as well because of delay in mammography screening, pap smear, as well as colonoscopy screening. And we know the worst outcomes if treatment delays for cancers, such as chemotherapy sessions and radiotherapy sessions, will be disrupted. And of course, in terms of survivorship, patients with cancer may be impacted with more infectious diseases, and considering their immunosuppressed states or immunosuppressed conditions, they may be at risk for vector-borne diseases such as malaria or dengue, which are very endemic in lower income countries. So such as what happened in Hurricane Maria in Puerto Rico, the impact or the disruption of natural disasters on cancer care may not be evident on the area where the disaster happened, but it may be remote, where in Puerto Rico, when Hurricane Maria hit, there was a national shortage of IV bag in the United States. And there were reports of staffing shortages, with only about 38 to 47% of medical staff was able to work within a month. And this really impacted the quality of care as well that was being provided to patients with cancer. What about the impacts of heat waves and oncolytic medications? There was just a report on how heat waves alter pharmacokinetics due to reduction in the blood volume distribution of the drugs, increasing the likelihood of adverse reactions. Chemo drugs also with narrow therapeutic indices may have delays in terms of absorption, elimination, and distribution, and this might translate to limited effectiveness as well as more enhanced toxic events. For patients with pre-existing metabolic or renal conditions, we know that patients with cancer also most of them have comorbidities, and they may even experience diarrhea, febrile illnesses, which may result to fluid loss and dehydration. Neurotoxic agents may cause heat-related morbidity, such as deranged reflex regulation of body temperature. And of course, heat wave UV radiation may interact as well with molecules that are responsible in medicine-induced photosensitivity, such as what we use in some of cancer types like fluoropyrimidines, BRAF inhibitors, and MEK inhibitors. So we know the impact of the exposure to disaster and cancer survival. In a 10-year survival analysis of those patients with breast cancer, colorectal cancer, and lung cancer, when they were compared to those patients who weren't hit by Hurricane Katrina, there was indeed a decrease in the survival when compared to those who were not exposed to hurricanes, as well as the impact of radiation treatment. There was a decrease in the survival of patients with locally advanced non-small cell lung cancer who were undergoing radiation compared to those who were not exposed to hurricane disasters. So another issue with the climate change is the number of populations who are displaced or either within their countries or areas or outside of their countries or areas. Just last year, 2022 alone, there are more than 32 million total of new internal displacements due to disasters. And how will this impact cancer care? We know that the disruption of healthcare access is very important in terms of impacting cancer care. We know that the continuity of care is very relevant and significant in cancer treatment, where patients are advised to follow chemo sessions by schedule, radiotherapy sessions, loss or damage of medical records, and even biopsy specimens. In my own practice, I have seen patients who have lost their biopsy specimens, their pathology specimens. So we are transformed. The practice of oncology has been transformed to personalized treatment. And we know that it's very important to understand the biomarkers, the molecular profile of tumors in order to appropriately treat patients. So this is a very critical issue in terms of personalizing cancer treatment. Of course, patients who are displaced may be exposed to new environmental risks. They may have exacerbation of mental health issues. To start with, are patients with cancer already being affected in terms of stress, anxiety, and the additional factor that will be put to them because of these climate issues will be affecting their overall well-being. In addition to that, the economic challenges and financial strain as well, because most of those climate migrants or displaced populations are from lower income countries. And the basics in terms of housing, food, and water will be the primary concern. And in that situation, medical care might really be compromised. Of course, the disruption of social support network is very important for a patient with cancer. Support from families, community, friends is very important for their emotional well-being. There may also be limitation to access to specialized care because it's not always a guarantee that they will be displaced or migrate to an environment or a healthcare system that will be able to support their specialized care. So again, looking at the inequity and inequality, the countries with the most natural disasters in 2022 are mostly lower income countries, and these are the countries with the least who are the least responsible that are being mostly hit. And these are the countries as well who are struggling in terms of the basics of cancer care. Most of the countries don't even have a national cancer screening program. Most of the healthcare systems do not pay or not reimburse in terms of medicines and diagnostics. So this will greatly impact how cancer care will be in the next few years. So what are the challenges for the oncology community? And along with these challenges, there are, of course, opportunities where oncology professionals and stakeholders will be able to harness. Of course, it is very important to advocate and be more engaged to identify the issue that we are all part of the problem, and we have to there are growing literature now available and understanding the carbon footprint of cancer care. And I invite you to look at the important publication about climate toxicity from what's the carbon footprint and the environmental impact of the cancer care and the processes involved therein. We also have to educate not only our patients, their families, caregivers, as well as our oncology colleagues and the other stakeholders. We have to find ways and to be environmentally sustainable, resilient healthcare we practice, as well as to more or less at least lessen the ongoing inequity, not only due to climate change, but inequity in terms of access to care. it's also important to have an interdisciplinary collaboration and mitigation strategies, and of course, the importance of research funding to understand more the impact and have solid data on how this impacts on cancer care will be handled well by all oncology stakeholders. So we are all, as oncology professionals, we always advise patients to promote good health, to have a well-being, to avoid smoking, for example. But we have to understand that when we promote programs and advocacies for good patient care, we have to understand that we are all living in a sick planet, and there's a disconnect in terms of promoting good health, but we cannot just tell patients to quit smoking or avoid smoking just to have them, allow them breathing unhealthy polluted air. So thank you very much for your attention.
Thank you so much for that, Dr. de Guzman. That was a fantastic overview of some of the issues, and particularly the sort of inequalities in those issues internationally. So we'll move on swiftly to Dr. Hilda Yelving, who will be talking to us a little about what we as an oncology community can be doing. So Dr. Yelving is a medical oncologist in Groningen in the Netherlands. Her main clinical interests are in melanoma and gynae cancer, and she has a very active role in early phase clinical research, with research focusing on understanding the altered metabolism of cancer patients. She also works with ESMO, the European Society for Medical Oncology, as the chair of their climate change task force, and is part of a consortium developing guidelines for teaching on the environmental impacts of medication. So I will hand over to you now. Thank you.
Thank you, Sarah. Can you see my screen?
Yeah.
Okay, perfect. Okay, so thank you, everyone, and thank you very much for the invitation. So following on from, I think, two really impressive talks, really showing us the enormous problem we're facing, which can be quite daunting. And so I'm going to try and take you through some steps that we as working oncologists can be taking. Yes, yeah. So as we saw just now, healthcare is part of the problem. So if healthcare was a country, it would be the fifth largest emitter of greenhouse gases globally. And I think we all see in our daily lives where that comes from. So this is a breakdown from data from the NHS. So if you look at this, you see that at least about 10% of the CO2 output is travel by patients, by visitors, by staff, also travel within the healthcare community itself. But far the biggest chunk of this pie is medicines, medical equipment. And if we look at our work as medical oncologists, a lot of drugs which we give, that's our daily practice, is about 20% of this pie is really medicines and chemicals that we use. So we need to start thinking about that climate change is making our patients sick, but also us trying to care for our patients is contributing to the problem of climate change. And that's something that we need to start tackling. Something which is an important question to ask is who is responsible? I think with this big daunting act, people have the feeling that someone else needs to solve it, and that who am I to try and start taking steps. But I think if we've seen in the previous presentations, I think everybody has this responsibility. The problem is so big that we have to look at this not only in our personal lives, but we need to start making changes in our own hospitals, in our own departments, but also seeing what we can do to move professional oncology societies to making necessary changes. So what can we do? So if you think about the principles of the 5 Rs, this helps, because reducing and recycling are at the bottom of this pyramid. The biggest advantages, or the biggest gains, are really refusing and not doing things. So the first point that we can think of, and Rosella touched on this as well, is reducing the demand for healthcare. So if we can prevent disease, promote health, there will be less patients that need healthcare, and also so less that we have to do to treat these patients. So we can spend whole conferences on prevention. I won't go further into this yet, but I think one of the things we need to think about, instead of freeing up a lot of money to look at new treatments, there needs to be more funding to really looking at prevention. The second thing is, which is something that we can implement in our daily lives, is really to start thinking about avoiding everything which is not necessary. And I'll come back to that in a moment. And the third point is then, when we do have to do things, we need to think about reducing the climate footprint of what we're doing. So when we're thinking about avoiding unnecessary investigations and treatments, there are a couple of ways we can start thinking about this. So the ESMO, so the European Society of Medical Oncologists, have developed the magnitude of clinical benefit scale. You can see it in the top left picture. And this is a system for looking at new drugs coming into the market to look at what their impact is compared to their side effects. And all drugs get a score. And this was developed mainly to improve our care for patients, and to make sure that we think about making the most effective drugs accessible in all countries. But if you look at this from a climate point of view, we can also start thinking about using this scale. So what we want to be doing is treating patients with the most effective drugs, making sure these drugs are available in all countries, and not treating patients with drugs that only have a very minor impact. The nice thing about looking at it in this way is that it solves multiple problems. I think we all realize that the cost of healthcare are increasing logarithmically, and also there we need to start thinking about what we should stop doing. And stopping things will also have impact on the climate. An interesting initiative which has come over from the US is the Choosing Wisely initiative. It's a global campaign which helps physicians and patients engage in conversations about how necessary a certain test or a certain treatment is. Because this is something that we have to keep doing, also continuing to discuss with our patients. So what is the benefit of the treatment? Do we need to treat the patient now, or can we wait? How long should we continue the treatment? Can we stop it early? Do we really need this dose? Do we really need a combination of two treatments, or is one treatment enough? Can we give things orally? Because a tablet always has less environmental impact than an intravenous infusion with the plastics, for example. And these are things that we can start doing tomorrow. Reducing patient travel is another, I think, relatively low-hanging fruit. So in the top, you see a picture of the Netherlands where I work, and the yellow circle is the region where our university hospital is. So we have a big, relatively rural region, and patients traveling very far to their appointments. If you look at the percentage of hospital CO2 emissions which are due to travel, it's 22% at our hospital. It was 14% in the NHS analysis. This is something where we can make changes, and I think all the digital platforms which are emerging will help. Also, this has multiple benefits, because a lot of patients, it costs a lot of money and a lot of time to travel to hospitals. It's intensive for patients, but also intensive for caregivers who also have their own jobs and their own families. So these are steps which have multiple advantages, and things we should really be implementing as soon as possible. Looking more to the surgical side, which is not my own daily work, this is a picture on the left of a patient in between all of the waste from her one operation for breast cancer. And you can see the huge amount of plastics which are used in just one operation. And there are a lot of small initiatives which are really excellent. For example, for cellulose mats, which are very environmentally have a big impact on the environment, and there are relatively small things you can do to reduce their use. So those are initiatives which are good and maybe need to be implemented further. Looking at our own work as medical oncologists, we prescribe a lot of drugs, and drugs and drug waste are a huge problem. So besides the industrial waste, as you can see in this picture, also hospital waste and domestic waste all end up in the sewage, all end up in the soil, which is used for agriculture, and all end up in the groundwater. Recently, there's been a lot of attention to the inhalers, which are used in patients with asthma, where some of the inhalers have an enormous CO2 footprint. Here you can see it in a graph. So here it's compared to a 115-mile petrol car journey, is only a little bit more CO2 than each single dose of an inhaler. Luckily, there's been a lot of move to more powdered inhalers to reduce these things. One of the big problems when thinking about this for the medical oncology side is that there's a lot of things we don't know. There's no openness of where the raw materials come from for the drugs that we use, what the production process is, what energy is used, whether there's a lot of water, whether there are heavy metals used. Increasingly, we have more knowledge on rational use of this medication, and also, for example, reuse of medication. So a lot of patients have leftover medication when they've finished their treatment, and there are nice initiatives showing that you can actually take these medications back into the pharmacy and reuse them for other patients. The other thing, obviously, is the waste. How do we recycle these drugs, and how do they end up in our sewage system? So one of the things that we're working on with a European consortium is firstly trying to think about which information we need to be able to understand how impactful these processes are, and also develop educational materials which can be used in the curricula for example, pharmacists or doctors. So on to the ESMO Climate Change Task Force. So as I said, the ESMO is the European Society of Medical Oncology, over 30,000 members. And the Climate Task Force was actually initiated off the back of an initiative by 3 Swedish oncologists led by Joachim Kroner, who decided to travel to the ESMO conference in 2019 by train from Sweden. You can see what their route looked like here. So off the back of that, the Climate Task Force was initiated, and its goal was to explore how the ESMO as a society can reduce its own environmental footprint. The initial steps were to organize train journeys to the conferences in the next years, and also to analyze the climate impact of our society. So the train to ESMO, so the vision was that in 2020 we would have dedicated trains of carriages from major European cities. I have an on the train networking opportunities and a pre-conference program. So everything was in place for that, and then COVID hit. So unfortunately, there were no trains and no conference that year, only in a very small digital format. So during the COVID years, we continued with a virtual train to ESMO format, where we had online sessions hosted from around the world, trying to raise awareness for the climate issues and what we as oncologists can do. And the idea was to use this virtual train to ESMO as a testing ground for the pre-Congress program, which you could potentially do during the journey. The other thing that we've been doing in the last few years is media campaigns trying to convert delegates to travel by train. So this year, ESMO was in Madrid. Next year, it's in Barcelona. And the idea is to try and get more and more people traveling by train. One of the things that was available this year for the first time is a ribbon on the badge of everyone who traveled in a climate-friendly way, with the goal of really promoting discussion among colleagues. What we also saw is that it's not easy to be green. So we traveled to the conference from the Netherlands with a group of 5 oncologists. You can see us here. And it was a challenge. Booking sites for trains open late. Trip planning is complicated. The conference location at the edge of Europe means that for most people, a train journey is not feasible. And to add to that, the main line between Barcelona and Madrid broke down. So we and a few thousand other people had to spend the night in Barcelona. But the goal of this was not so much to show that this is, for this length of journey, a feasible travel option, but to show, to gain attention. For shorter journeys, we really need to start converting people to travel by train. So if you think about Europe and you think about the number of short flights, this is where we can make changes. So does your hospital have a green travel policy? We do. I must admit it's not implemented very well. This is where we live, and they've calculated that this whole green area of Europe can be reached by train within 9 hours. And that was the limit which was set, which was feasible to ask people to really travel by train. And I think that's something which more hospitals need to be thinking about, developing, but also implementing. So if we look at the analysis of the climate impact of our large conference, the vast majority is travel. So if you look at global warming potential, which is 1 ton of CO2 output, the global warming potential was 1.5 per participant on average. The majority was travel. For the rest, accommodation, the venue, temperature controls, the conference bag, and consumables and catering. So what is this 1.5 global warming potential? If you put that into perspective, so the average ESMO participant spent 1.5 global warming potential. If we look at the Paris target per person, we should all limit our yearly CO2 budget should be limited to 2 GWP. So you see that on average, an ESMO participant almost spends all his allowance for CO2 in 1 conference visit. To put this into perspective for the different countries, obviously our country still needs quite a lot of work. Sweden is doing better. The US has even more work to do. So what can we improve on the small scale? So we did a calculation to see what happens if you move the conference location from Spain, so Barcelona and Madrid, to Paris. And what you see that even if everyone in Europe flies, the flights are shorter if you have the conference in Munich or Paris than if you have it in Madrid. And if you then factor in what happens if you ask everyone who's within, say, 6 to 8 hours of train travel to travel by train, you can reduce the output even further. So these are things which need to be implemented, but it's challenging. Conference locations in Munich and Paris are smaller and more expensive than those at the edges of Europe. And these are all factors which influence how relatively simple advices like these can be implemented. So what have we been able to do as ESMO? So all publications are moving to online only. So the journals are no longer distributed to members. They're accessible online. No more conference bag, which is thrown away at the end of the conference. Push towards more digital hybrid conferences so that people can join from home. We're exploring conferences from hub locations so that you can enjoy the conference with your colleagues from your own country, have networking opportunities, but not all have to travel to the main conference. Combination of multiple events to reduce travel needs, and looking at eco-friendly travel and accommodation. Big steps we still need, and where there's a lot of request for, is educational materials to spread the awareness and really get things implemented in everyone's own hospital. We're thinking about producing guidelines. There are a couple of good examples. The NHS has a climate guideline, for example, and that's something that we need to think about for the oncology community to really look at the specific problems in our area. And it sounds like, and it feels like we've only taken very small steps at ESMO, but what we've seen in talking to the OUCH members and to ASCO and ESTRO is that even these small steps, everybody is trying to look at each other to see what can be done, because there are big steps still to be taken, and everyone's still at the beginning of this, unfortunately. So take-home messages. I think it's become really clear also from the talks before me that it's time to act. We need really big steps, but my important message: don't forget small steps. Don't be daunted by the huge task ahead and then forget to do the things that you can influence. Create awareness, but also lead by example. So engage your professional societies. Think about where you're putting your money, your investments. Demand openness on the footprint of the drugs that we prescribe our patients, and use your votes to support climate initiatives. Basically, what can we do? Less of everything. Everything that you don't need to make more climate friendly because you're just not using it. Less travel, better travel. less throwing away, think about heating and cooling, thinking about reducing paper, and thinking about all the small steps you can take in your life. You don't have to be perfect. So a lot of people say to me, you know, you can say all of this, but I saw you get in a plane. I think it's not, if you don't need to promise to never fly again to really be able to reduce the amount you fly. And I think that counts for a lot of things that we do. So thank you for your attention and looking forward to the panel discussion in a moment.
Thank you so much. Thanks, Dr. Allen. Now I'm going to switch us now to be able to see everybody and introduce our additional panelists. So we have Dr. Joan Schiller, who'll be chairing this session, who is a thoracic oncologist from the US and the founder of OUCH, who are hosting this meeting, so Oncologists United for Climate and Health. We're also delighted to be joined by Mixolisi Sabanda, who's an advisor on climate change with the Commonwealth Secretariat, where he's been working on implementing the Living Lands Charter, which is work focused on the land-climate nexus, and has also been doing a lot of work on climate financing, and more lately exploring health and climate. We're also joined by Dr. Rob Shooter, who is a clinical radiotherapy physicist at the Christie, where he works on researching MR-Linac, but also is chair of the IPEM Environmental Sustainability Committee, and has been publishing work on the carbon footprint of radiotherapy. So thank you all for joining us. Sorry, the discussion is slightly curtailed due to the fantastic talks that we've had, but I will hand over to Dr. Schiller to chair this.
Thank you very much. Appreciate being here, and sorry I'm a little late signing on. But let's get straight to the discussion, and we've got excellent panelists today. Let me start out with you, Dr. Sabanda, if you don't mind, and that is, how do you think we can support colleagues working in low and middle income countries to better adapt to the effects of climate change? And I should also say, please put your any questions in the Q&A box. Thank you.
Yeah, thank you, Jo, and thanks to everybody for wonderful presentations on climate, cancer care as well. I think coming from the Commonwealth, we've got a huge burden of cancer care, and the cases are increasing within our Commonwealth. And the Commonwealth is made up of a lot of small island states that Roselle did mention, vulnerable countries, whether in Africa or the Pacific or the Caribbean. So this is a very live issue. And I think several issues have been pointed out, but I think I probably would say it's important to realize that those are the countries that are impacted, whether in terms of infrastructure, in terms of the cases of cancer rising in those places. And so it's important for health professionals to begin to realize that climate will exacerbate the burden that's brought onto the healthcare system. And so it's important to engage. I think Deborah did mention issues to do with finance. And I think in those places, health facilities are minimal. So we've got to look at how we can increase finance towards that. And I think a number of people listening today are probably involved in cancer care, but also research. And I think to ensure that the money comes to where it's most needed, it's important to begin to highlight some of the evidence that links cancer, that links cancer care, climate. One of the challenges we face, particularly with small island states, vulnerable countries, is that their access to the finance is actually quite limited by the lack of evidence. When you apply for funding from international climate finance bodies, there is need for evidence that, you know, what you're saying will have the impact. And so I think one of the actions that probably needs to be taken is or supported is that sort of research that evidences, even in small ways, the impact of climate on cancer care, the impact of the health sector on climate. I think those two need to be done a lot more. That way it will help to access the finance that's actually quite needed. Design of facilities, I think we still have an opportunity, especially in small island states, vulnerable developing countries. We've got an opportunity to design and facilities that are climate friendly as much as possible. So those actions, I think, are some of the law, in my view, low-hanging fruits that I think health professionals need to probably pick on. I think Roselle mentioned the collaboration. I think that's very, very critical going forward. Back to you, Joe.
Thank you so very much. Just building, before we go to the Q&A box, just building upon what you just talked about, let me ask Dr. Shooter, how do you think the oncology community can push for higher level action within their own countries and internationally? What can we do?
So I don't know, it's hard to know what to do, but like the handy thing is that doctors and the people that deliver the treatments, the radiographers, are very trusted by patients. So if they can start having the discussions with their patients and telling them the kind of the impact that climate has on their treatment and the kind of the impact their treatment has on the climate and how it affects them and their kind of families and their kind of their children and stuff like that, it will have a big impact, because if you trust the person's telling it to you, you're more likely to act. And if they can then kind of act and do something about it and be aware of it, they spread it to their friends, and you can start having quite a big impact. But kind of sadly, we're still at the educational phase of kind of starting to mitigate climate change and solve climate change, but it's an incredibly important part. So the kind of education is the thing that we can mainly do at the moment.
Right, for sure. Thank you. Yeah. There's a question that I will throw out to all of you, and that is, how can we convince decision makers to include strategies to mitigate climate change into cancer control plans? Who would like to take that one? How about you, Dr. Jalving? Hilde? How can we convince decision makers to include strategies to mitigate climate change into cancer control plans?
It's a difficult, I think nobody's jumping because it's a difficult question. I think what I've noticed with the ESMO, we started with, we've got a very enthusiastic group of people who are really committed, but we don't realize the level of complexity enough. So you really need to all of our ideas, you need to fit them into all the other concerns people have. So you really need to get, but I think what was said before, as soon as it's mandatory, if it's in a guideline, if it's in the legislation, then that's the way to make people really implement the change. So how do we convince them? I think it keep attracting attention, keep talking about this, and I think the world is becoming more open to this. You hear more questions, we're seeing more interest in the climate sessions, you're seeing a lot of interest from patients as well. A lot of patients are asking questions, what is the impact of everything we're doing? So I think we need to harness that as well.
And it's having the evidence to answer that question as well, right? So, kind of what is the impact of my kind of cancer care? If we can kind of give them a number and say what that compares to, that starts giving them a feel for it. But I think having those small groups starting to do kind of initiatives like yours, Hilda, and kind of working out the kind of carbon footprint of having the conferences and what you can do to kind of try and mitigate those is a good start. It's a kind of definitely a bottom up, but by more people kind of doing the bottom up means that the policymakers will eventually start having to hear. Certainly in the UK, the kind of the people at the top seem to be completely kind of deaf to it. But eventually, as the more kind of people at the bottom start really pushing for it, the more they'll have to act. Is kind of, I suppose, it can feel quite powerless about it. And quite regularly, kind of you kind of say you're kind of doing your little bit, and then people are like, well, what's the point? It's like kind of that is a kind of a tiniest, infinitesimally small part of what the problem is, but by everyone doing something, and as Deborah showed, that kind of even that kind of tiny little bit of kind of temperature change makes a massive difference. And if we don't reach a tipping point, then that's saved a huge amount of problems as well. So it is important.
Yeah.
And I think
Maybe just adding to that, the other thing which works is if it leads to less costs and less time for doctors, for patients, those initiatives work, because saving money is often higher on the agenda than climate, unfortunately. But if we can identify initiatives which can tick both boxes, those are the easiest to implement. So maybe it's the low-hanging fruit, but that is a good place to start.
And you regularly get ones where it's a win-win-win, right? So it's financially kind of better, socially better, and probably better for patients, and environmentally better. And those win-win-wins happen quite often, and they're obviously the ones that you want to start with.
Yeah.
So we only have a few. Oh, go ahead, Sarah.
I was just going to say, and you mentioned the legislation as well, Hilda. I mean, now in the UK, it is, part of law that healthcare has to reduce its carbon footprint, and I think that is helping, across the board, and also from a guideline point of view. WHO last week put out their guidelines on developing sort of resilient and low carbon health systems that are accessible and appropriate for countries internationally, and trying to raise the profile of those and make sure people are adhering to them is probably quite important.
For the non-UK folks on the line, what is the law that you mentioned, Sarah, about healthcare?
It's part of their Health and Social Care Act now in the UK, includes a requirement to adhere to our carbon commitments, so reduce the carbon footprint of healthcare.
Very good. So unfortunately, we only have a few minutes left, and I know there are other questions in the Q&A box, but let me just quickly ask everyone to go around, and what is the one last thought you would like to leave the panel and the audience with? And Professor Roberts, can I start with you? One last takeaway message.
Yeah, I suppose being a practitioner, mine is a reality check. I think we've got a suboptimal future ahead, which means I think the health sector needs to put in place a long-term game plan to deal with it. And I think there's a call on all of us to become more politically active in our professions, to begin lobbying for the kind of policy and legal changes, the movement in financing and greater equity. I think we've got to be thinking about equity as we move forward. These actions can benefit some, but some may be excluded, and we need to be mindful of that.
Dr. de Guzman?
Climate change is not only an environmental challenge, it is a critical health issue. And with the cancer as one of the major causes of morbidity and mortality globally, you have to understand that the threat is there in all the continuum of cancer care. And we have to understand, the stakeholders, the policymakers have to understand the strong interconnectedness between climate change and cancer.
Dr. Jalving?
Yeah, so I think we need to stop being too daunted by this task and really believe that we can start making changes in our own lives, but also can make changes within our own professional societies and move towards really getting these changes implemented.
And as someone mentioned earlier, I think if everyone does a little bit, you can accomplish a lot. Dr. Shooter?
I think I'd probably pick up on the political active thing that Deborah said, because we can kind of make changes, and we all should, but they're still small. They multiply up, they're still small. But with the stroke of a pen of a politician, you can change so much, right? So if they kind of implemented some sort of tax on frequent flyers, you could change a huge amount much in one go. So it's being politically active and pushing for change, I think, is the biggest thing.
Excellent. And Dr. Sabanda?
So I think there is opportunities for incredible change. At least in the Commonwealth, every 8 seconds, someone dies of cancer. I think it's important that healthcare professionals, particularly in oncology, begin to make the links. And I think there are already opportunities within national processes in terms of, country NDCs. So these are the nationally determined contributions. I think oncology professionals, health professionals need to link up to that, because that's a process where countries have already made commitments, and those commitments can be looked at, and from a health perspective, from an oncology perspective, what can be done and put in there. And where we can, it's important to collaborate, particularly with the most vulnerable, in trying to ensure that systems are designed to cater for the concerns of climate, and also to make sure that the impacts of climate change are reduced on patients.
Excellent, excellent. Thank you all very, very much for just a wonderful session. I think everyone's learned a lot. Appreciate all of your time. And with that, Dr. Briggs, I will let you wrap it up.
So thank you so much, everyone, for a really informative and inspiring session. I think it's been a fantastic contribution to London Global Cancer Week, and I think I would echo some of the comments we've just made about the importance of justice here, and climate and health justice in the context of a Global Cancer Week, and how we frame this as an international issue in which we have a huge responsibility towards people who've contributed very little to climate change so far. And I hope that we'll have further discussions on this between us, and do reach out to other colleagues about this, and hope to have another session next year where we can build on this and see what we've achieved in a year. All right, and good luck at COP to Deborah and Louise. Hope it's productive. All right, thank you so much, everyone.
Thank you very much. See you.
Thank you.
Bye.
Bye-bye.
Thank you. Bye.